one or you and a friend come with me, you have concerns, you want to review for exam or something in the class you're not understanding, even dosage calc, if you need help, just ask for help and I'll make time for you. Because, to get math wrong on these questions, you really shouldn't get these questions wrong. It's just basic math. There's no mics per kilo. So it is more how many micrograms per kilogram per dose are you given, or how many micrograms per kilogram are you going to give if this is the liquid they sent up of that. So milliliters per hour. And then there's heparin questions. So it's not horrible, but if you've seen my handouts that I sent you, it does have 5 questions similar to those you're going to see on your exam. So if you can do those, you're good. You have answers to all of the questions, so you can review it. And, I've already done my review. It's already out, posted on YouTube. I've also put it on an announcement page where I'll say exam 1 reviews, and you'll see me just add a review under the next one. So you don't have 3 different announcements with 3 different reviews. I'll try to keep you organized. So the one page has my review and Professor Morris's review right now. After Professor Corafor does hers on Saturday, I will add it to the same page. Also, the dosage calc review is there, and all your Kahoots are listed. And I also, again, attach the study PowerPoint. Now, I cannot attach more than one thing on an announcement. That's why I sent the message with the 3 attachments for the dosage calc. So I have given you everything you need, all the tools you need. And if you don't know how to use them, or if you're having troubles, please just let me know. It could take 15 minutes on a Zoom call, and I'll work with you on your times, okay? So today we're already in week 3. We're doing chapter 34, 35, and we're going to be talking about school age and adolescent children. This is from age 6 to adult. So again, it's a broad period of time, and there are many changes mentally and physically and socially that go on. Quiz 2 is open. It has a lot of questions from last week and this week. They're combined there, okay? It shouldn't be any surprises on it. You've seen the information before, whether in a PowerPoint or in a Kahoots, you've seen the concepts. Your case study, Burn, is due by Sunday. So make sure that's in, and 50 NCLEX questions. Next week is our exam. So come in a couple minutes early, 10 to 15 minutes, so I can look at your IDs, look at your surroundings, check your paper, your pen, make sure everything's good. I usually get started by 5 after, which means that you'll be going, you'll take your time taking your exam, and you come back to class at 20 after 4. And at that time, I do week 4 Kahoots, which is the information you need from the week. So instead of a PowerPoint, I'm giving you all the concepts you need in a Kahoots, okay? And I would tell you if there are things that you really need to go back and review in the readings and where that's going to be, okay? I try to give you what you need in the best manner. So I work really hard on week 4 Kahoots to make sure that you have that all. So any more questions? We're good now? Your exams are ready for download. Just make sure they're downloaded before you come to class. I made sure that actually all the classes had their exams ready for download this morning. So classes across the board all have that now. So we're going to do a PowerPoint, then we're going to do a Kahoots, and we should be done about 20 to 5. Okay, which basically is giving you your break time back, which is what I like to do for you. You don't take a break, so it's your time. So we'll get it done as quick as we can, but in a manner so that you still understand. I won't be sitting here doing no speed talking. I don't know how my tongue gets tied too quickly. So from the beginning, pediatric nursing, week 3, we're going to go with school age children. This is ages 6 to 12. School age children start with baby faces, And by the time they're 12, they're looking grown up already. But it doesn't mean that their mental status has grown up with the way that they're looking. That's the issue with this older school age children. It starts with the rest of the baby teeth coming out, getting all of your permanent teeth in, and it ends at puberty, where it starts now going into the adolescence. Again, the growth is going to be very slow. It's not going to be like that infancy where they triple the birth weight. No, it's still that 4 to 6 kilos per year. It's not going, no, 2 to 3 to 2 to 4 kilos per year. It's not going to be a whole bunch of weight going on. And again, it's stair step. It's going to be weight going to be, you know, maintained, and then you're going to see yourself gain weight, and it's going to that stair step again. And of course, you're going to get older. You're going to be more mature, hopefully. Physically, you're going to be able to do more. You're more coordinated. You're going to be more athletic. Performing at sports is the big thing. So height is 2 inches a year, not much. But if you look at school age, it's 1 to 2 feet, but it's 6 years. It's from ages 6 to 12. The weight, again, as I said, 2 to 3 kilos, and your weight will double in the 6 years, okay? Boys or girl are a little different. We don't go into a lot of the inches and how high. We just at these ages state that it's slower progression. They're not going to gain as much per year, but they're still slowly gaining weight. As I said, their movements are more graceful. If they're a ballerina, they're going to be more, you know, able to stretch and be more graceful. Even a boy who's in baseball is going to be more graceful, running around the bases and catching balls and be more, you know, that depth perception, being that shortstop, trying to catch that ball that's coming quickly. They're able to, because now their muscles are better, their legs are getting longer, and you know, they are becoming more adept to their bodies. They've grown into their bodies at this point. Their head and their height is really nothing at this point. And as I said, it starts from the baby face and it goes to the mature face. And I know that the beginning of the school age is all I want for Christmas, my 2 front teeth, right? All those teeth come out. And I think little 6-year-olds that don't have their front teeth with a smile, I think it's really cute, actually. Their body systems also mature. Their bladder, they're able to hold it more. They're not needing to go to the bathroom every hour on a road trip. Their heart, which took a lot of their chest as an infant, now is becoming smaller. It doesn't look like it takes up the whole chest anymore. Their immune system, of course, is going to get more effective. They've had all of their immunizations, you know, if they've gotten them all up to date. Plus, they've been sick with, you know, how many viruses and earaches and et cetera, that now their body has a great immune system. Now, in the beginning, those bones, remember I keep telling you they're softer, they're more malleable, the heads can mold back around. Well, by the time of the end of school age, you're going to see those bones become more ossified, which means they can now crack a lot easier. They don't mold as well. They are, you know, stronger. And as I said again, physical maturity does not correlate with that emotional or social maturity. There are some little children that look like adults, but when you put them in situations, they're going to handle them like a younger child. And this is normal, absolutely normal. All children react to things differently. So we talk about prepubescence and puberty. We talk about the difference between boys and girls. Know that girls usually start puberty about age 10 and boys are at 12. There's 2 years difference. This is the age where the girls are starting to grow up and mature more than the boys. And although they still like the boyfriends, they still think, you know, they're silly because they haven't grown up, because they are maturing themselves. Now, talking to a school age child, again, going to depend on the age. Is it a 6-year-old or is it a 12-year-old? So explain on their level. But when you need to take an x-ray, don't think you can say, you know, to this 6-year-old, you need to go get an x-ray of your chest as a picture of your lungs and they'll come back. Well, you've said the word x-ray. what do kids look at X-ray and think? You know, superheroes, X-ray eyes zapping through you. So it's not a good word. So instead of saying that, say it's just a big camera. It doesn't, nothing comes out. You don't feel it. You don't see light, nothing. You'll just hear a beep and it's going to be done. But when it's done, I'm going to show you what your broken arm looks like, what your lungs look like. And now they're going to be excited because they have to have a thing come close to them, you know, and, you know, or stand to the side with their arms up if it's a chest x-ray, or put their arm that's might be broken down. Telling them what they are going to see, what they are going to feel will make this an easy experience. Or you say x-ray and they think of that x-ray vision and, you know, lights coming out of the eyes and burning things as they, you know, go around with this light thing. So just be careful with children because we don't know where their minds are. They're just so creative. You're going to inspect, auscultate, percuss, and palpate. These are things we do to look at a child. I mean, just looking at a child first, you can tell if they're sick. We've talked lymph nodes before. If you don't feel them, good. The kid's not sick, kid's fine. But if you feel palpable lymph nodes, this child is sick. There's something going on, an infection. As in, when we were talking health assessment, well, we have to do assessments on children too. So how do you assess for the hypoglossal nerve? Well, even infants will do it. Have them stick their tongue out. Even little infants will try to imitate you with your tongue out. So you can do it even on them. And there's difference of checking breath sounds with children because they have these really short open eustachian tubes, huge adenoids and tonsils, and mucus tends to sit up in here. So sometimes you're listening to the chest and you think it sounds like bronchi and rails and it's just noisy, but it's not the lungs, it's the upper airway noise. It's all that mucus gurgling in there. You're hearing referred noises, right? So listening to bronchial, which is the bronchus, the tracheal bronchus here, this is telling you, is it that upper airway mucus? As you go lower, then you could tell, is it that sound you heard or is it a sound in the lungs? So listening to children's breath sound is actually very difficult. Now we're going to go into some of the theorists. Now, Freud is very similar to Piaget in the very beginning. The sensorimotor, right? Sensorimotor is that in the mouth, but it's also with the Piaget has to do with touch, feeling, and movement. Freud just says that as an infant, it's all about everything in the mouth. You soothe yourself, you suck, you bite, you chew. This is your explore the world through your mouth. Now, as we go older in Freud, it talks about heterosexual. It goes same-sex peers. He's all about sexuality and psychosexual things. But Freud, as a school age, is just same-sex peers. That's who they tend to fall in with. Now, Erikson. This is questions that you'll see on the NCLEX. Erikson and this stage in particular in infants, they love to discuss and see if you understand. Well, Erikson says that it's a sense of industry versus inferiority, okay? So what does industry mean? Well, in school-age children, they love to accomplish tasks. They love to be able to do something, do it well, and be praised for it. They love to be independent. They love to be able to, let's say, you know, comb their hair, do their braids and put bows in and get dressed and, you know, make dinner for mommy or coffee or breakfast, or even in school, they want to be the one who spells the best, writes the best, is the best at math. That is their industry. What they do it well. They want to be able to do that. So then what's inferiority? Well, that's when they can't do something well. Maybe this child is great with cooking and good with spelling and math, but when you put them outside to do any social activity, that they are very inadept outside. Go ahead, you can have the phone, honey, go.
My phone's charging.
Okay, go ahead, honey, close the door. That's my little grandson. He's been having GI issues. So Nana's making sure he's okay. He goes home tonight. I fixed him. So anyway, inferiority. So this child goes out, goes in PE, being chosen on teams, the last one because they can't kick the ball or they can't throw the ball, or the math. They just don't understand math, so they feel inferior. So industry, what you do well. Inferiority is what you can't do and you really would love to do. School-age children want to be able to do anything. Okay, does that make that better understand? That's Erickson. Piaget. Piaget is now using experiences and then thinking about them and start looking at relationships between things. They understand that I went and I fixed my room up, made my bed, and then mom was so happy. She took me to the mall and I got a new shirt. So doesn't that tell you if you did it again, that maybe nice things breed these rewards? But it wasn't why they did it. It was just this event that had happened. They're starting to be able to think of what they should do in certain reasons because of what they've done in the past. You know, I come home and the door's locked and, you know, I know mommy's coming home soon. What do I need to do? Well, I know she'll be upset if I go to the neighbors. So, all right, let me just wait here by the door, but I'll wait over here so I'll be safe. Now, those are all conceptual. They thought of what they needed to do at the time. And school-age children are old enough to do this. They also know the concept of conservation. This is when you have a little Debbie's cake for the week. And if you eat all of them in the first couple of days, you're not going to have any in the end, like my children would do. And then in the end, they realized, well, my son used to hide them everywhere. But if you space it out, you will have a little Debbie's cake for every day when you come home from school. That's conservation, okay? Or making sure there's enough milk in the refrigerator for the week so they have cereal in the morning. All of those things, they're starting to think about that, where earlier they just thought, you just get a new gallon of milk, right? Just go get it. Also, part of it is having water, liquid, and you put it in a short cup or a tall cup. If you put it one in the other, the tall cup looks like more, but you know it's the same liquid because it came from the same cup. Or a piece of clay, whether it's round or you smush it, it's still the same amount of clay. If you take and reorganize the way that things are patterned down, if still 10 pennies is 10 pennies, right? So they're starting to get this concepts now. They're starting to see these things. Kohlberg, again, this is also about good and bad, reward and punishment. And they know sometimes you will see that they will do something even if they know it's wrong because they wanted it that much, even though that they're going to be punished. But they also do those good things because they know they're going to get those rewards. So Kohlberg, again, is good and bad and the consequence that comes with it. But understanding how to use good and bad when they need it too. Their spiritual development, very concrete. What do they understand? Well, the younger children of school age might understand that, okay, Christmas is coming, there's a Christmas tree, I'm getting presents, and we're gonna go to church that night, really late at night, and I'm gonna fall asleep. And then Santa Claus comes when I go home and go to sleep. You know, that's what they may understand. Jillian, you have a question? It's okay, you put your something. Oh, okay, you got a thumb up. Yeah. Okay. So another thing about the concrete is they understand what they've seen, what they've learned, and the culture of the family, whether what's been told to them. Do they know all about the manger and God, or they only know about Santa Claus, or are they Jewish, or are they another faith? All of these things come from what they, from the parents. But every child wants to know about whatever the God's name is, whatever the name of the God. Doesn't have to be God. It could be, you know, any name. But these children, school-age children, if they do something wrong, they expect to be punished. And I'm going to give you a great example of it because it's something I realized working in an emergency room. Young children, 7, 6, 8, that to 9, that area, I used to see a lot of children come in with appendicitis and they have to go right to surgery. So they come in, they're in pain, and we diagnose they have an appendix. Every child, what I would do is I'd sit down next to them and I say, whatever their name is, I said, listen, you didn't do anything wrong for this to happen. There's just a piece of something in your belly that didn't want to be there anymore, but it wasn't because you did something or did something right, or you hit your sister, or if I heard something that the child had said, has nothing to do with it. And another thing I'm going to tell the doctor, because I don't want your insides and your bleeding to come out, because that's what they believe. I'm going to tell him to make sure he puts an extra little stitches in there to hold it shut really tight to make sure your insides stay there. And you can literally see their shoulders relax. And it's like this feeling of relief that they're not being punished because they're going to surgery. This is scary. And they're taken away from the parents at a point. This is scary. So if I've told them that it's not their fault, it doesn't make it that bad anymore. Okay. So this is a true, real belief of these children. Peer groups, really important, same-sex peers. Children love to go out and do activities after school, whether it's sports, whether it's, any sort of clubs. And this is, again, we're starting to pull away from just the family, just the parents. Now we have other people that are influencing your children as they grow, getting them ready for when they're old enough to go out, get their own homes, go to school, go to college, right? So starting to teach them about the real world here. And we know those sex roles, same-sex peers are very important at this time. So the clubs and peer groups are part of that. That is an organized activity where the children get out of the house, somebody else is guiding them, and they have goals to achieve. Problem with many of these goals are there are other girls or boys, whatever group it is, that are going to bully. Well, I've got more medals than you do. You didn't get that one because you forgot to. You have to be careful with bullying. That's why parents still need to be there to ask, so how was Girl Scouts today? How was Boy Scouts? You need to be involved in that because those things do happen. So the relationships with families still need mom and dad to be a parent. They do not need them to be their friend. They still need those good structure at home, but to listen to them because there are outside influences there. I mean, mom, dad, the family is the most important influence, but there are other influences, but that needs to be watched. Play, again, play. Children play. I mean, adults play. We're always doing something, and it keeps us alert. So it's the rules, it's the rituals, it's playing together, it's reaching a goal, it's doing something well, whether it's playing piano or how many books did you read this summer? All of these things, play, it helps these children grow. Their self-concept, they're starting to be aware of what they can do, what they are able to do. And then they're being aware that, I've got pretty neat curly hair, or my freckles are cute, or yeah, I got pretty blue eyes, or the bows in my hair people like, or, I'm good at math, I'm good at this, whatever. They're starting to be aware of all of these things before. And as adults, whoever the adult is, whether it's in the club leader, whether it's the sports leader, mom, dad, anybody, it's that stroking the child and making them feel like they've done a good job. That, when you praise them, they're going to want to please more. So they will have more feelings of self-respect. They're going to like themselves more and more because they can do things good. As I keep saying, it's body image. They're starting to learn what it is. They're not in hate like adolescents are yet with their body, but they're starting to learn that they are different. The hair and the eyes are probably the most looked at, but they're also looking at differences children who are shorter, taller, heavier, skinnier, they're starting to see if they have hearing aids, glasses, braces. They're starting to notice these things. When we have children entering school, that beyond preschool, this is a longer period in time. And this is the shaping of the child to be prepared to be able to work with others, and to achieve the goals that they need to achieve, getting themselves ready for the moment where they get out of the house. They're starting to be prepared as they grow older through school. Okay, so it's a really sharp break from, mommy's house to Nana's house to school. And this is where they start socializing with other children. And now they're starting to be aware they're, peers, their same-sex peers that are their friends, starting to understand the differences in their culture and things. And of course, probably going to their home and understanding new foods. They're starting to understand that there's more to life than just what they have seen in their own home. Nutrition, 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 always an important thing. We know that school-age children tend to like all the fast food stuff. And we know that today nutrition can be difficult because children are more sedentary. They're using technology more. So if they're eating snacks, they're getting heavier, and obesity has become a problem in the school-age children right now. We know that today it's hard. Two parents working, and especially if there's only one parent working, going to school, doing everything that needs to be done, and there's no dinner, and you drive through fast food. It's the best you can do, but it's not the bestest choice. But we also know that all the good foods actually cost more than the fast foods. So sometimes it is the only choice. So as I started talking about obesity in children, it is reaching epidemic proportions because of what? They're not outside. They're watching TVs, on computers, videos, games, telephones. It's more important than going out and hitting a ball or, riding a bike around the neighborhood. Or they can't because the environment outside is unsafe. And that is some of the cases. But overweight children have an increased risk of high blood pressure, diabetes, hypercholesterol due to, and it's called the cardiometabolic changes in their body. So if you're an obese school-age children, the possibility of having these three things and more is a huge, high probability. So if we can target these school-age children, teach them about obesity and how to eat and how to save themselves from it, it would behoove us, because we don't want these children to become adults who are sick. So these preventative strategies should start, in pregnancy and work up through infancy. It is no target group, no ethnic group is more than the other. It's all ethnic groups are a part of this. It's not any single one. We know that at times, what I've seen with school-age children, and I know I come from a huge family. I have 6 brothers and me. So there was 9 kids, and I was a very, humble family. My mom and dad both worked. So when dinner was on the table, you ate. And if you wanted seconds, you better have eaten quick to see if there was seconds, because probably not. But if I left something on my plate, I was forced to finish it, because there are hungry kids everywhere, right? I mean, we've all heard that saying. The problem with that is once you have started this and put this in the mind of a school-age child, they become adults who have to finish their plates too. And when you do that, what are we doing? We're promoting obesity. If you're not hungry, you're eating, is what we've done. Sleep. Now, school-age children should have 9 to 11 hours. They should have. We know the younger school-age children are going to fight going to bed. I need a glass of water. Can you read me another book? I got to go to the bathroom. And they go on and on. The older children say, listen, I'm tired. I'm going to bed, Mom. And they go into bed. But, that's the change. Sports is good. It's great to be competitive. Again, problems. Some children are physically ready and emotionally ready for it, and some aren't. Sports, again, is a competitive thing where you have a lot of children working together with the same goal in mind, to run around the base and, collect the runs. But again, this is a competition where there's a lot of bullying, so parents, have to be, with that. And of course, making sure there's proper equipment, protective equipment to save them, so that they're not going to, so they have the helmets on their head, and maybe, gloves so they don't get hit, or proper shoes, et cetera, et cetera. And, boys, you got to protect the jewels. So, a cup for them. So at least they're getting, some exercise. They're out, they're with other children, and it's a great thing. Children love to win. I mean, my 5-year-old keeps telling me, did I win? Whether he did or didn't. I said, well, it was close, but let's do it again. Let's see what happens. But competition is big and they love to do it, but they need to learn how to lose too, right? So dental health. Now, they say in children, if they brush their teeth at bedtime, it's the best we can do to help their dental health. They say that will help. Now, flossing, most younger school-age children are not coordinated enough to floss yet. So at least if they brush is a good thing. We'll see children who need dentists and with braces and all of that. Some, never do. One thing that happens a lot in children is their teeth. They bop it on the side of a pool. They fall down on the ground, and their front tooth, usually the upper right or left, always the upper right or left, and it comes out by the root. Now, do you know how to get that tooth to a dentist to be able to reimplant that? We put it in cold
milk.
Cold milk. Yes, Lisa, great. You put it in cold milk, and I don't know if it's the cool, I don't know if it's the calcium, I don't know, vitamin D, but it keeps the tooth preserved. And if we get it into that mouth within 4 to 6 hours after removal, it will retake. It will retake. They numb the area with a good numbing cream, okay? And they really squirt it in there, and they leave it to make sure it's as numb as it can be. They don't put a needle or anything in there. And they take the tooth and they put it, and actually they jam it up in there and hold it really tight. Then they were told to follow up with a dentist and eat very soft foods. But can you imagine a permanent tooth coming out and what you'd have to do if you couldn't get that tooth back in? So it's a good thing. So just get them to a pediatric dentist in cold milk. Sex education, school-age children have all sorts of questions. They are in the point where there is an age where it's starting to become more and more questions between friends, between peers. So this is a time where we should be teaching them more, whether it's the school nurse, parents, to teach them, rights and wrongs, good touch, bad touch, right? As a nurse, I mean, most of the time, sex education, you'll see more discussed as a school nurse. I've not had many school-age children ask me many things in my career, about sex or sexuality. It's mostly, I've heard school nurses, friends of mine, who the questions they ask that you'd be surprised. But sex is normal, treat it normal, questions are normal, but ask the child what they know first before you start telling them anything, because they may really know absolutely nothing, and you don't want to say too much with it. And you're allowed to talk to children. They have questions, let them know. And then of course, if they can speak to their parents, it'd be the best thing. But if you can imagine me, I had 6 brothers, I was the only girl. I wasn't talking anything about sex to my parents because I was the girl and I was going to be protected. I mean, there'd be no way. As I said, school health is a great nurse to be. If any of you want to be, it's a great profession. You're off all the holidays that your children are. You can have summer breaks off. You can have winter breaks off. in it's a pretty neat job actually. Um, when COVID came, they really were put to the test because they had to respond to COVID viruses. You know, is it safe for children? Masks, no masks, barriers, what's going on, and keeping the community aware of what was happening. That was a huge thing. Now, before COVID came about, what would be a school nurse doing? Well, a school nurse could be any child sick, goes to them, et cetera, et cetera. I've seen them where I have a child who was positive bacterial meningitis that we had to notify the school, so the school nurse could send a letter out to those children that might have been on the same school bus, the same lunch time, or the same, you know, classroom, that if they were close enough, they should take one prophylactic antibiotic pill. And this is what the school nurses do. They really follow it. You know, the flus they follow, you know, and then keeping up with CDC protocols. So school nurse can be a lot of fun. Injury prevention, you know, children, you think of injury, always think motor vehicle. That's always number one, okay? Always think whether they're adolescents driving and running over something or into something, or as a school age child that they're in a car that has an accident. They say you should be in the rear seat a child till they're 13. Now, I never did that. I know when I got divorced at age 9 and 11, my children were, they used to call shotgun, who's going to sit in the front seat with me? And it was these rules that weren't there. But remember, my children are 38 and 37 now. So they're older. So these, you'll see all of these restrictions have come up because there's a lot more evidence that shows you how we can prevent injury on our children. Booster seats till 8 years old. Bicycle helmets should be worn even around the neighborhood. In fact, probably it's where you're riding it the most, so absolutely in a neighborhood. When they came out with those little scooters, those little hovey boards that you just put your legs up, feet up and down, and you didn't need anything to hold on. The first Christmas they came out, I saw two boys, I think they were 11, 12-ish, and they both had bilateral fractured radial ulnas on both arms bilaterally because they put their hands out. They didn't have the proper protection. They needed those wrist restraints on to prevent their wrists from being broken. Trampolines are horrible. I would never have one in my house, although there's one in the back of my house, and I watched this boy bounce, listening for him to scream one day, but so far not yet. So children and taking care of them. Children are now gone from really needing just mom and dad and they're comfortable in the environment. Now they're getting out, working with teachers and other adults and whatever clubs, school, etc. They are starting to be more independent by themselves, not needing parents at times. And again, parents need to be that support, but let them do what they need to do as long as it's safe, right? Just keep them safe because they're moving towards the outside world. They're going now, you know, through school age, go to adolescence, and then it's on to live by themselves. One of the things that happen in school age children, it's usually diagnosed then, is ADHD. Now, this would be the child who's in the classroom, who can't sit, who is constantly disturbing the class. So eventually this child will be sent to the school nurse, and usually more than once. So what usually the school nurse will do with this one is call the parents in and find out what they're doing for this child. Now, don't ever assume that this kid is allowed to get away with everything at home, that they have done nothing to help them. There are many parents who have done everything, have taken everything, privilege at home away, and they are still ADHD. You know, they're unable to sit and finish. So first of all, when you have an ADHD child, listen to the parents. Listen to what they've done first, very quietly, before assumptions are made. Then you will make a plan that works for the family and for the child. Okay, very important with these ADHD. They look like a kid who's spoiled, who doesn't listen to anything. That's what they can appear to be, but they're not. These children have a true and real disorder, and they need help of some sort. So an avulsed, knocked out tooth, they are reluctant to put it back in the mouth. Where is a tooth going to be placed for transport?
The A.
It is in cold milk. Yes, it is. Thank you. So adolescence. Hold on to the roller coasters. This is what I call adolescence. This is that rapid transition between childhood and adulthood. They are growing physically, cognitively, socially, and emotionally. So they start as a kid, and in the end, they're more of an adult. So it starts with the beginning of their sex characteristics. They start with girls would be breast buds, right? That's their first in the Tanner's stages. And in boys it would be, the enlarging scrotum. So these are the two things it starts with. And then it stops with the end when they stop growing, about 20 years old. So there's two types of sex characteristics. What we have a need for reproduction and all those other things that make us us. The hormone, the voice, the hair, the breasts, the fats, those things. So as I said, first pubescent change for boys is testicular enlargement, and girls is going to be breast buds. And this is Tanner's, and what they say is you start as a child and you end up with an adult, whether you're a girl or whether you're a boy. And that's what that depicts right there. Physical growth. Well, in the very beginning, which is now you're going through puberty, it's what we call the growth spurt, and it's 20 to 25% of your total height. So up to a quarter of how tall you are is during this 2 to 3 years. Okay, these children need sleep, they need nutrition, don't they? And this is your ages 13, 15, right around that age right there. So this is part of what happens. Now, Erickson. Now, Erickson in adolescence. Well, what do we know about adolescence? Well, this is a point where it's their identity. Who am I? What do I want to be? Do I like girls? Do I like boys? Do I like both? What, do I like music? Which peer group do I want to be with? Where do I want to go when I grow up? I mean, all of these things is like identity. What's happening to me? So that is what identity means, okay? Through social development, now they are now trying to define what their independence is. And they don't want parental authority. They don't want mom and dad telling what to do. They want to be more independent. Although this ambivalence is, they still love mom and dad, but at this point in time, it's okay, I'll be home, mom. Let me go out and be with my friends and them, right? So it is also part of this intense sociability and intense loneliness. I describe this as, there's times where every day you're somewhere after club, you're going to the movies, at the mall, meeting at school, doing this and that. And then something happens, like, you were sort of liking this boy and we're talking to him, and your best friend, you saw them talking to that boy and gave him a kiss on his cheek. So now you've lost the best friend and you lost the boy. So this is the intense loneliness, because these things happen within these little groups. So, and they get very, very depressed with these sort of things because they want to be accepted by their peers. And now, what did two of them just do to you? It's like, I'm not good enough. Maybe I'm too heavy, too fat. Body image. They are so into body image. Like, my hair's too short, it's too long, I need a haircut. Oh, I had a pimple. I gained 2 pounds, whatever. Now, their roles with the parents are changing, as I said. The parents want to protect children and keep them from making mistakes, and it's very difficult. It's hard for parents to let go, and it's hard for children to understand why these parents are trying to hold them back. Why aren't you letting me go out with my friends? No, you cannot come in at 3 o'clock in the morning. You need to be home by midnight. And that's quite reasonable for a 15, 16-year-old, you know? So, but it's difficult. So it is turmoilous and full of ambiguity. Love mom and dad, but I need to do what I need to do. I'm so frustrated with my parents. They want to have privileges. They want to be able to do what they want, but do they want to do all the responsibility that's required? They need to do good at school. They need to take the garbage out on trash day. They need to make their bed, put their clothes away. Are they doing all those things, or they just expect all the privileges? This is part of being a teenager. And when it's the major conflict over independence and control, okay, it's ages 15 to 17. They're not that younger age. They're not the older. They're right in the middle where they think they're old enough, okay? What would a nurse do? Well, you suggest they sit down with their child, try to set limits and structure. It is very difficult. I've been a parent of teenagers. I understand it completely. Thank goodness I held on for the roller coaster ride, and they turned out pretty good. Relationships with parents is now more of mutual affection and equality. It's, you know, you have to let them do what they need to do within boundaries, you know, but still you want the love from your son and from your daughter. You know, there are times where teenagers do need to go for emancipation, which means depending what age they are, they can go to the court, and they don't need parents to be able to sign consents for them. The parents don't need to do anything for them, that they can sign on their own. And this child, let's say they're 14, they're emancipated, they have documentation, they can sign their own consents in a hospital, even at age 14, okay? And that's the emancipated teenager. Their peers are very important, very important. It gives them a sense of belonging, gives them a sense of strength and power. And best friends usually are, again, same sex, okay? And usually they are in that same identity group that they're looking for. Now, the funny thing about best friends is, as an adolescent, it's been shown that how you treat your best friends is how you're going to treat your partner in life. So if you're good and understanding to your best friend, that's the way you're going to be for your partner in life. But if you don't remember things, forget things, and for your best friend, you're going to be like that in your partner for life. So building a rapport with adolescents as a nurse, probably one of the most difficult. I mean, even with infants and toddlers, you can sit down and play with them and make it fun. Well, adolescents don't want you to make it fun. Okay, so how are you going to build a rapport? Well, start asking them about what do they do for fun, or they've got earbuds in. You're listening to music. What sort of music you're listening to? Oh, have you seen a concert lately? Oh, I went to this concert. It was really great. Oh, do you like that music? I haven't really gotten into that. I mean, start a rapport that you're sort of understanding, okay? It could be the type of sneakers they have on, or a style of shirt, or something. Another thing that can happen is, remember, they're looking for identity, right? You will see female girls dressed more masculine. So I would ask them, what would you like me to call you? Because, you know, sometimes you'll hear, okay, their name on the paper is Donna Smith, okay? And you want me to call, and you hear something about Dawn or something that the parents call you. I was like, so what name would you like me to call you? In anything, culture, whether it's the culture of who they are, ask the client themselves. Teenagers can tell you what's going on with them. You don't need to go through the parents all the time. You can ask the parents, but it's the child will talk to you. This adolescent, they're very aware of themselves. HPV vaccines are given about age 9 up to 13, and boys can get them too. Nutrition is very hard to evaluate nutrition on these children. Teenagers tend to grab a bottle of water and a snack bar or two, run out of the house because they're busy for the day. Plus, they're overweight. They think they're too fat because body image, so this is all they're going to eat. And then when they come home, they'll have dinner at mom's. This is the way adolescents think. So what happens if they get sick? Whether it is diabetes or any other issue that can be concerning with their nutrition. Well, that's the child that you're going to need that 24-hour diary of the foods eaten, because it could be a bite here, a bite there, water here, and maybe they got a soda in between. Who knows? But teenagers, a 24-hour diary works. Now, adolescents, remember the beginning, they've grown 20 to 25% of their total height, right? Their nutrition should be the best, so should their sleeping. But guess what? They don't have time to sleep. They're busy studying, doing their homework, trying to get those grants for school. They're also at the mall with their friends. They're playing sports. They're in the band. They're in this club, that club. They don't have time. They're busy with social activities, so they don't sleep as much as they should. They should get some exercise in, but they're busy, so maybe they will. And always dental health is important. They should brush their teeth, and these children should floss it also. So sexuality, we know what the TV shows today. I mean, there's nothing you can't see on TV today at all. I mean, I have to be careful with my little 5-year-old grandson. You look over and there's 2 people in bed and you're like, okay, next channel, let's put on Nickelodeon, right away. So we know it is part of, sets that drive to, plus, adolescents are very curious. So where do we get information from? Well, I've already said school nurses, right? Parents, if you can. Well, I didn't. And then Planned Parenthood is always a great resource for them to go to, as long as they get the proper information. And as nurses, what are we allowed to say? Well, not our opinions, okay? We need to say, written and oral information that's accurate, not opinions, okay? And usually school nurses have gone to like Planned Parenthood and gotten brochures and have them in their office so that the child comes and asks questions. Then here's a brochure, let's go over it a little bit, etc. Again, injury, go right to that motor vehicle, right? Motor vehicle, firearms, and then sports, because they're trying so hard. And, we do try to promote injury prevention by warm-ups and using proper equipment, etc. So Matt is 14, he's always eating. Remember the age, 14, although his weight is appropriate for his height. The best explanation for this is what? Take a guess.
A.
Absolutely. Remember, this is the adolescent growth spurt. He is eating because he's getting bigger and taller. So yes, it is that. Good job. So those are your school age and those are your adolescent children. Jessica, you're on a TV. That is adorable. I like her screen saver. You see that?
Thank you.
Yeah, I like that. That's something different. All right, who wants to win cahoots today? Sharon, are you ready? Yeah, okay. Lisa, you ready? You were listening. So you, Ashley. Yeah, Rosa?
Yes.
Yeah, Tammy got this one. I know you do. Let's see who does it today. And we're running right on time like I thought we should, so we're doing good. Nine, 4, 8, 1, 9, 2, 5. Anybody else trying to get on? All right, let's get her going. Week 3, school age adolescents. How does the onset of pubertal growth spurt compare in girls and boys? So in girls, it's 2 years before boys. Whether it is 10 and 12, that's usually the numbers that they come up with. Sanders up top. At what age should a parent expect to have major conflicts over independence and control with their child? When did I say those major things happen? They're not this young, they're not that old, they're like, and this is ages 15 to 17. They're not young. They're now, remember, independence. They want to get up and go to the mall and out and be with their friends all night long. This is the independence. And they want to control when and how they do it. This is those 15 to 17-year-olds. That's when they want to do it. Okay. And Brent's up top. The onset in puberty is characterized in boys by, how do you know they're starting puberty? And that's testicular enlargement. I mean, one of the things that happens is a voice change, but what you will see is the testicular enlargement. That is a visual, something you can see. Signs of onset of puberty in girls is and that is breast buds. Very good. And Brent's on now fire. The source of injury, whether intentional or unintentional in adolescence, is associated with so when you talk injury, children, think motor vehicle accidents. And Sandra's back. If a parent feels uncomfortable talking about sex education, who is a good resource? And that is the school nurse. You know, going to peers, you're not going to get proper information. So school nurse, you're going to get accurate information, written and oral. A 9-year-old friend tells him soccer is a dumb game and he should play baseball. Why did he say that? So peer acceptance is so important, especially in the school age. You know, they want to please and they want to be with their peers. So they'll play what, you know, the other kids playing just because. During admission, if father of a 16-year-old says, we are Buddhist, culturally competent care includes what? Well, if they say they're Buddhist, How would you respond to that? So always, you don't understand something, you will get more respect from the child, the parent, your adult, doesn't matter, more respect by asking than trying to assume. When teaching sex education for contraceptives for adolescents, what should the nurse consider? So again, with contraception, sex education, you will give oral and a written form of information to them, okay? You are not going to give your opinions. You're just going to give them information. A multi-select. The management of adolescent obesity should include so absolutely 24-hour diary. We have no clue what they ate, but in any diet, especially adolescents, you're going to have to put some of their good food in there. You know, saying, encouraging diversional activities. This is good for a young kid. It's not good for an adolescent. The nutritious foods, most adolescents don't want nutritious foods. So, but if we can keep a diary, find out what they like, what they don't like, and then incorporate their favorite foods in there somehow, it'll be a diet that will work for this child, hopefully. Infants go through a predictable sequence of growth and development. This is called. Now, I will throw questions in from the weeks before. Predictable sequence is a sequential trend. It is you're going to lift your head up, turn over, then you're going to pull yourself to the crawling, et cetera, et cetera. This is predictable. We know that's going to happen. It's in a sequence. Which of the following drugs is the most common drug of abuse in the adolescent population? And it's alcohol because it's easy to get. They go into parents, closet and pull some out, put it in a water bottle, put water back in their stuff, and keep going. I mean, I've heard that story by many a student telling me. I didn't keep it in my house for my kids. Which benchmark serves as the ending period for the middle period of development? So at the end of school age, what do you see? Begins with they're losing all their body teeth, gaining all their permanent teeth, and what at the end? And that's onset of puberty. So they gain all of their permanent teeth, and then it's the onset of puberty, and that's the end of school age. An example of indirect bullying would be if, I mean, today we got to watch out for this more than ever because, bullying used to be just, you talk to me. It's not that all of that anymore. And it is social media, and there's so many social media things out there, and children can be abused from it. And I've actually watched a couple programs on bullying and how it led to depression and suicide. because they were so overwhelmed by what this bullying was all about. So it is serious, really is. Which action would improve dental health in the school-age child? Now, I should revisit this question and say the older school-age child, because a younger school-age child, so an older school-age child, you should encourage to floss for sure, or the adolescent. But a regular school-age child, the younger ones, to at least brush their teeth at night before they go to bed. They are still not coordinated enough to floss yet, okay? That's the problem. Not that they can or shouldn't, it's just they don't know how to yet. So the older school-age child can floss. The younger one, only brushing their teeth. Generally, the earliest age at which puberty begins is 10 in girls, 12 in boys. It's 2 years apart. Very good. And Cody's still up top, but Ashley is on fire. An 8-year-old girl said she has cancer because God is punishing her for being bad. Why does she say that? And it's absolutely common. It's like me telling you about the children going for appendectomies, how I would sit with them and let them know they did nothing wrong. So they're not being punished. But it is an absolute common belief that, and if you don't put a Band-Aid on it, you're going to bleed out and your guts are going to come out. So that extra stitch really works. A 5-year-old needs to get a chest x-ray. What explanation is best? So just going to take a camera. We're going to look in there because x-ray's not good. Don't tell them it's not going to hurt. They don't understand. And you could talk a 5-year-old telling them there's consolidation in the lungs. They're going to say, oh my God, something has happened to me. Something's in my chest. Consolidation. They have no clue what that means. How do you get an adolescent to open up about their sexual history? I mean, many times when you have adolescents, whether it's at your doctor's office or urgent or ER, these children will not talk in front of their parents. So the first thing you're going to do is have the parents get out of the room. Say, 1 second, mom, I need to speak to your child alone. When we're done, I'll pull you right back in. Now, you don't have to tell the parents what this child said, unless what they tell you is harmful to themselves or others, okay? So they can talk to you openly and honestly, and then maybe you can give them that written and oral information that they need, right? But to have them to open up is first. Tell me about your social life, what music you listen to, whatever. Start a conversation, and these children, they will. Now, be surprised with what they will tell you. Sometimes they like to tell you things that will shock you. So try not to have that face that goes, what? Because really, they can tell you things that. How do you get an adolescent to be more receptive to talking about their health and sexual exploration? So again, have the parents leave the room for sure. And again, you don't have to tell the parents unless it's something that can hurt the child or others. Multi-select. When educating adolescents about risks for HIV and hepatitis, what would you include? So abstinence, of course, condoms, yes, and hand washing. And I certainly hope they're taking more than weekly showers. A child has a knocked out tooth. Where would you place that tooth for transport to the dentist? Because you can go to a pediatric dentist or you can go into a pediatric emergency room. There's a children's hospital, use it. So it's cold milk for sure. Cody, you're back on fire. A nurse planning care for a school-age child should know which thought process is seen. School-age children, how do they think? So remember we talked about the ability to conserve, okay? They know what they need to have, so they plan for it, whether it's the milk, whether it's little Debbie's cake, whether it's making sure they have enough uniforms for the week, whatever it is, they can conserve it. Magical thinking is your preschoolers, and animism, and thoughts are all powerful. That's when you get into the ministry, I think. What stage of Erickson's would you use for a school-age child? How do I discuss school-age children to you? They are pleasers for sure. They love to be able to do things. And they love to be able to do things, do it well, but they're sad because they can't do everything well. So that's the inferiority part. Can't do it. A multi-select. Anorexia nervosa is caused by So there's two different diagnoses on eating disorders that basically I cover in a cahoots. It wasn't needing a lot of information, but anorexia nervosa is when you're afraid to put food in your mouth, that you feel like you are fat even though you're skinny, and you also will overexercise too. Fear of weight gain, unrealistic body, and severe caloric restriction. Now, vomiting and purging is not anorexia nervosa. If you see, let me do the next question and then I'll go into some more. How do you know if you suffer from bulimia? So two type of eating disorders that you see is anorexia nervosa and bulimia. Now, bulimia is when you eat like unbelievable quantities of food, but as soon as you eat it, you throw it up. Now, you will see a difference if you don't know. If you have two skinny adolescents, you don't know if they're anorexia or bulimic. Look at their teeth. If they're bulimic, that gastric juices have rotten usually their teeth, and you will see really poor quality teeth in their mouth, okay? Anorexics don't eat at all, so their teeth are fine. Bulimic children, you're gonna see them rotted, okay? And Brent's on fire. The leading cause of death from unintentional injuries in children, I think you all know this one really well. Motor vehicle fatalities, absolutely. Children, all ages. Adolescents are. Hold on for the roller coaster ride, as I called it. They're somewhere between childhood and adulthood, but it's also a times of being troubled, frustrated, and confused. Identity. They don't know who they are, where they're going, and it's a really troublesome time for them. So they also go into a lot of depression, and a lot of it has to do with body image. Body image is huge, and belonging to that peer group. What is an adolescent's heart rate? So an adolescent is slightly lower than an adult, but it's right there only because they're slightly more active, 55 to 90, and that's absolutely normal for an adolescent. So, you've seen from infants, 140 to 160, up to your adolescents. When talking with an adolescent regarding personal health concerns, which is most important? Absolutely. Just let them talk to somebody who's going to listen, and they know that you're just going to give them proper information. And sometimes it's all they want. A parent says the infant puts everything in their mouth. Based on Freud's theory, how would you respond? Remember, I talked about Freud, very similar to Piaget's sensor-motor. Everything in the mouth. And that's how they explore the world. And it's also that sucking, biting, chewing, according to Piaget, which gives them stress relief, gives them pleasure, gives them comfort. Two different theories, a little bit of different thoughts. In addition to injuries, the leading cause of death in adolescents ages 15. Why is this up here? So adolescents, depression is big because of their body image, so suicide. And then they're doing these, risky behaviors, which could be also homicide, whether it was planned or not. Those are the two things that you'll see most of. In school age, conflict of industry versus inferiority. What does industry mean? Mastering a task, being able to do something well, spell well, cook well, play the piano, good at a video game, whatever, something I do well, makes them feel good about themselves. At what age does intuitive thought start? And this is about the ages of 5 to 7, starting putting things together. They can figure if this is red and this is red, it's a different shape, and all of those things are okay. Which age group prefers to be with members of their own sex? And that's 9 to 11. That's, your school age. And that's becoming the last half of those school age. Absolutely same sex peers, but even the younger ones could also. Which age group would have the tendency towards eating disorders? Well, and you think of who is upset with their bodies and body images. It just makes it very easy. It's absolutely your adolescence. True or false? Home support is invaluable to the adolescents. Do they need mom and dad? Do they need them to support them? Home support. And absolutely they do. What if that incident happened where, the best friend was talking to the guy she liked and saw him kiss him, and, now I don't know what to do, mommy, daddy. You need those supports there at that time. Mom and dad still need to be a part of the child's life, but it's in a different role at this time. Letting them try to make mistakes, but, giving them some boundaries and responsibilities. Contraindication to administering a varicella vaccine to an adolescent. This is a question I put here because it doesn't matter med-surg, doesn't matter your NCLEX. This is a question they love. What do we know about a varicella vaccine? Doesn't matter the age. Could be a young child, could be an old adult. When you're on varicella vaccine, you're given a live vaccine. Who don't we give that to? Somebody immunosuppressed. Which one of these is immunosuppressed? If you're on steroids, you're immunosuppressed. Okay, it is a question you will see written like that. You might even see it in your med-surg, but it's a question I put here just to open your mind. Live vaccine, immunosuppressed, it also can be because of prednisone, okay? To improve adolescent health, adults must increase health-enhancing behaviors such as so they should be eating food, they should be exercising and getting sleep, and they're not doing any of them because they're too busy with their social life. And Sanders back on fire. What clinical findings does not indicate an adolescent may be suffering from anorexia nervosa? I think a lot of these symptoms here are hypothyroidism, aren't they? If you look at it. But they're not getting enough nutrition, vitamins, hormones, anything. So it could be sort of in that regard. But dry skin intolerance to cold, constipation could be hypothyroidism, but it's also anorexia nervosa. They don't have enough nutrition in their body. There's no fuel for nothing. Decay in teeth is only bulimia. Your anorexic will have nice teeth. They won't use toothpaste because they think it has calories. The risk of depression in transgender children is extremely high because are they being accepted? I think these new reality TV shows have brought it more into light today. A 14-year-old in the emergency room after a biking accident. How should the nurse interact with the adolescent? I worked in the trauma ER. I was always called on to be the primary trauma nurse, which means whoever walked in the door, that was my patient. And, 14-year-old coming in is going to be on a backboard with a neck brace taped to a board. People are going to be running into that kid, getting x-rays, cutting clothes off, starting an IV, getting labs, whatever, all quickly. So what am I going to do? I'm going to be behind that child's head talking to them, letting them know what's going on, telling them this is going to happen. This is going to happen. Because when you know what's going to happen, you're not afraid, okay? If mom and dad are there, they're going to be outside, but having somebody with them also, and they can watch what's going on. It's okay. Cooperative play. Good old play. So cooperative play is kids working together to reach a goal. Checkers is a great explanation of that. Or let's say they are together with a bunch of blocks and together they decide we are going to make a house. Let's make a house together. When the house is done, they both won the game, right? Absolutely cooperative play. All sorts of play. Please review those for your exam. What does moral development involve? Well, whenever you see moral, think Kohlberg. Moral development is all about Kohlberg, that theorist. And when you think about Kohlberg, it's right and wrong and a consequence for either, okay? Kohlberg, very simple. And of course, it's also about same-sex peers too. Developmental milestones are important to observe because learning all these things. When do they roll? When do they turn? When do they grasp? When should they walk? Why do we need to know all of these things? Well, children are so resilient. If we can get that clue that they need something early, we can institute that early intervention, and those children can catch up very, very quickly. Lymph nodes in children with normal findings should look like what? And you shouldn't be able to feel them at all. When they're sick, they'll be enlarged. The right second intercostal space landmark of the heart is called. Now, assessment was part of some of the first week's chapters to read, and health assessment on a pediatric child is important. There is a great review on your slide that talks about the landmarks. Absolutely, you need to review them. The right second intercostal space is the aortic valve, okay? So go to that slide, look at them, know where each landmark is. Which nerve controls critical movements of the tongue? As in, how do you see if that nerve works? Stick their tongue out, right? So that's the glossopharyngeal or your cranial nerve number 9. What type of breath sounds do you expect to hear over the trachea? And now you understand why we do breath sounds of the upper airway and the lower airway. Is it just upper airway noise and mucus, or is it really breath sounds? So over the trachea is these bronchial sounds. You're going to see gargling in the bronchia, but it's usually up in, those tonsils and those adenoids, which is creating that noise. Children are very hard to listen to breath sounds to and get an accurate listen. Depriving a child of food, clothing, and shelter, what is that called? It's absolutely neglect. I mean, there was a case where two children were out in the front yard playing with the ball. One of the balls went out into the road, and the car just slightly touched the kid running out in the road. And of course, police were called. The parents of the children were arrested because they had no coats on and it was 30 degrees outside. It was considered neglect. This was a story in the news. This is something I didn't make up. This is a story in the news where okay, the child, they were out front, but it wasn't that. It was that they had no coats and it was too cold and it was considered neglect. Why are they outside with no coats on? Which of the following immunizations is given in the adolescent stage? So when you talk about immunizations, you talk adolescents, it's the HPV virus. We're going to be given that so we can prevent. Are we going to give varicella? That's with a kid. And herpes zoster? There's a vaccination now. There's a shingles vaccine. ADHD most likely involves which of the following? What is ADHD? It's all about not being able to sit still, inattention, impulsivity, and hyperactivity, you know, and working with these children is difficult. It's trying to find what works so that they can become more organized. And last question. Adolescents typically place blank on their peer relationships. Absolutely high value. Yes, they do. They need them to feel good and important. Number 3 is Jill. Number 2, Brent got taken over at the end. And number 1, Ashley. Ashley got you. Number 4, Sandra and Hannah. Good job, guys. But I'd like
Ashley, how do we answer the same amount of questions right and you still get number 1?
because somebody answered quicker. It's
Yeah,
the
quicker. The
difference.
quicker you get it. You got to be with the button, man. You got to get
And
it.
you got to be a quick button. You do.
Fair.
Yeah, the quicker you hit it, the more points that you do get for sure. So, oh, Hannah's got a little one today. A little one. Oh, mommy's nose, glass. Yep, okay. Any questions for me? You have an exam next week. If anybody needs help with anything, understanding anything, please just let me know. Okay, I'm here to help you.
Are we gonna have more reviews?
You're having one more review Saturday at 9 a.m. You have 2 already recorded on your announcement sheet.
But it's not obligatory, right? We don't.
No, you do not have to go, but it has been shown students who go to reviews and listen to the reviews get at least 10 points higher on the exam. So
I just say because Saturday we had clinicals, so
that's fine.
I'm not
Okay.
gonna be able.
You will have it posted on your announcements and you'll be there to listen to it, okay?
Okay,
Is-
thank you.
You're
Is
very
there a
welcome.
study guide for this one?
This is a PowerPoint study guide.
Okay, it hasn't been put in the announcements or?
It's in the announcements.
Okay,
Yes,
I
it
will
is.
keep an eye out for that.
I've actually, there's 2 announcements it's in. When I announced it and telling you when the reviews were, and then I put it again with the reviews recording. So there's 2 places for it.
I see it now. Thank you.
No, you're very welcome. Tammy, I'd love to give that one a little hug. Oh gosh, is he adorable. Look at that face.